All right, we have a lot of topics here. Pulse, cardiac cycle, EKGs, also blood pressure. You should have these notes. So first, what do you remember about the cardiovascular system? This is not our first lesson, so what do you remember? All right, we're going to do a little bit of review first. So remember, it's a closed system, and the components are the heart, the blood, and blood vessels. Most of the functions of the cardiovascular system are related to transportation. Transports oxygen and transports carbon dioxide and transports nutrients and transports waste, transports antibodies and transports leukocytes. But it's also responsible for some regulation of body temperature through the processes of vasodilation, blood vessels increasing in diameter, and vasoconstriction, blood vessels decreasing in diameter. The heart, remember, your hardest working muscle, it pumps blood and maintains blood pressure. It is about the size of your fist. Its mass is about 250 to 350 grams, so that's less than a pound. And it's located between your second rib and your sixth rib in your thorax, between your lungs. It's behind your sternum, your heart protector, and it's tilted slightly to the left, that apex of your heart. Okay, some normal values to remember. Heart rate for adults, 60 to 100 beats per minute. Blood pressure, 120 systolic over 80 diastolic. The heart sounds are lub dub, and they make that noise when valves close. Think about slamming doors. Blood has four major components. Plasma, the liquid portion of the blood. Erythrocytes, those are red blood cells. Leukocytes, those are white blood cells, and thrombocytes, those are platelets. The three types of blood vessels are arteries that carry blood away from the heart, veins that bring blood back to the heart, and capillaries, the tiniest little blood vessels that allow diffusion and exchange between arteries and veins. There are four chambers of the heart. The right atrium on the upper level, ventricles below. So right atrium, right ventricle, left atrium, left ventricle. We have the major vessels of the heart. Now think about this. If I wanted to do a heart transplant, I would have to remove those major vessel connections. So inferior vena cava, superior vena cava, the aorta connections. Okay. In addition, remember the descending aorta continues and it would be down here. So I'd also have to be thinking about removing that connection. We have the pulmonary veins and we have the pulmonary trunk. I wouldn't have to remove that, but I would have to for the pulmonary arteries. The valves of the heart, remember, they keep blood flowing in one direction. So we have tricuspid. We have bicuspid, we have pulmonary valve, and we have aortic valve. Other key features of the heart, we have the septum and we have the apex. Remember the tilt, the apex. Now, blood flow on the right side of the heart is going to come in from the superior and inferior vena cava into the right atrium, and then travel through that tricuspid valve to the right ventricle, and then travel through the pulmonary valve into the pulmonary trunk, and then out the right and left pulmonary arteries and go to the lungs. Now, this blood vessel is unique, the pulmonary arteries, because they are arteries, but they are carrying oxygen poor blood because they're headed to the lungs. Now, blood on the left side of the heart comes back from the lungs in the pulmonary veins. Again, these are the only veins that carry blood full of oxygen, oxygenated blood. And it's going to go into the left atrium, then through the bicuspid or mitral valve into the right ventricle, through the aortic valve, and into the ascending aorta, then the aortic arch, and then the descending aorta. Now let's talk about some key topics for today: heart rate, pulse, and blood pressure. So what is heart rate? It's literally the number of times your heart beats per minute. What are some things that can affect your heart rate? Well, your age, your fitness level, your hormones, the nervous system, because it's sending signals, stress, medications, diet, dehydration, and also medical conditions. What is pulse? Pulse is that rhythmic dilation of an artery caused by the beating of the heart. So the ventricles are pushing blood out, which starts to flow. And as that push happens, the arteries pulse along with the heart. Where are locations that we measure pulse? Okay, there are lots of them. Wherever there's an artery close to the surface, the superficial artery, we can measure the pulse there. The radial pulse is the most common location for pulse to be measured in a person. First of all, it's a little bit less invasive and it's easy to follow. If someone is unconscious or I need to find a pulse rapidly, the carotid pulse is often used because it's an emergency situation. Normally, I wouldn't want someone headed for my neck, but in an emergency, and especially if I don't have consciousness, that's going to be okay. And then we have the dorsalis pedis pulse right here on the top of the foot. This is one that is typically checked in diabetics or if there's a concern about circulation to the feet. Okay. Just like there is a radial pulse, there is an ulnar pulse on this one. The radial pulse is just more superficial, so it's used. Okay, so where do doctors and nurses most commonly evaluate pulse? Yeah, the radial artery. And again, why? Because it's less invasive and it's easier to maintain contact with that area long enough to measure pulse. Where would pulse be measured in an unconscious person? Right, that's the carotid artery. And why? Because it's the strongest pulse point, why it's literally closest to the heart. And it's a more aggressive approach, but in a potentially life or death situation, that has validity. So what is blood pressure? Well, that's the pressure of the circulating blood against the walls of the blood vessels. Now, if our arteries cannot stretch as much, they have decreased elasticity, our blood pressure goes up. So naturally, as we age, typically our blood pressure goes up because the walls of our arteries are less elastic. How do you measure blood pressure? With a tool called a sphygmomanometer. Sphygmomanometer. Okay, here's the range for high and low blood pressure. Okay, remember normal blood pressure, 120/60. And then there is a range for when blood pressure is considered low and when blood pressure is considered high. This number right here, systolic, that's the top number. Diastolic, that is the bottom number. So hypertension is high blood pressure above 120/80, and it has a lot of potentially very serious side effects. And low blood pressure or hypotension means there's not enough pressure and it can result in death just like hypertension. But with hypotension, it often occurs with loss of blood due to injury. There's just not enough blood moving around to create pressure. Now, what is the cardiac cycle? Well, it's all the events that occur in one heartbeat, and it takes less than a second, so about 0.8 seconds. So it controls the rhythm and speed of the heart, and we need the rhythm and speed to be controlled for our heart to be efficient. So the cardiac cycle has two separate parts. It has an electrical event, and then it has a muscular event. Now, the electrical event happens first, okay? It causes the contraction. It's what causes the heart muscle to actually contract. Now, for the muscular event occurring in the ventricles, we have systole, contraction, and diastole, relaxation. Now, both the atria and the ventricles have cycles of contraction and relaxation, just the ventricles are more powerful. So let's look at this in a little bit more detail. So the first thing that happens is the SA node or sinoatrial node, called the pacemaker of the heart. It begins the cardiac cycle. So it sends a signal, an electrical signal. So yes, your heart needs electricity to function. How do you know that? Ever seen the paddles? Yeah, we need electricity. Now from the SA node, the signal goes to the AV node or the atrioventricular node. So if you think about that, sounds like it's between the atria and the ventricles. Now the purpose of the AV node is hold up, delay the signal. It allows the atria to fully contract and push all of the blood in the atria down into the ventricles. I don't want the ventricles to contract until the atria have finished contracting. So the purpose of the AV node is hold up, let's wait a moment. Now the AV bundle or bundle of His, it brings the signal down the septum and it separates into right and left branches. And it's going to send the signal all the way down that septum to get to the ventricles. And then we have Purkinje fibers, and they bring the signal to the cardiac muscle cells in both ventricles, these tiny little branches. Why? Because I want all of the cardiac muscle cells in the ventricles to contract at the same time. I don't want it to be this weird, uncoordinated contraction. So we have SA node, pacemaker, AV node, hold up, delay the signal. AV bundle or bundle of His, send the signal down into the ventricles. And then Purkinje fibers make sure all of the cardiac muscle cells in the ventricles contract at the same time. So what are the two main parts of the cardiac cycle? We have the electrical event and the muscular event. So what is number one? Yeah, the SA node. What is number two? Yep, the AV node. What is number three? The bundle of His or the AV bundle. And number four, those are the Purkinje fibers. So what is the pacemaker of the heart? The SA node. What brings the signal down the septum? Bundle of His. What delays the signal so the atria will fully contract? Who's the holdup? Yeah, the AV node. What brings the signal to all of the muscle cells in the ventricles? Purkinje fibers. Now, there are a few ways we can monitor the heart, obviously without doing heart surgery, right? So we have an echocardiogram, a sonogram, and ultrasound. So with these, we can monitor the muscular events, we can watch the heart contracting, and we can also see the opening and the closing of the valves. So we would use an echocardiogram if we wanted to assess the overall function of your heart. Now, do you know anything about EKGs? Because that's another tool besides an echo or echocardiogram of your heart. So an electrocardiogram or ECG or EKG can monitor the electrical events of your heart's contractions, and it records 3 separate waves. So we have the P wave. That's the first little blip. And that's when the atria contract, okay? And the ventricles are relaxed at this time. Okay, the QRS wave, the big blip. That's when the ventricles contract. So you can see it's a much stronger contraction. What's also happening is the atria are relaxing. That's kind of hidden by the much bigger and more dramatic event of the ventricles contracting. And then we have the T wave, and that's where the ventricles relax and prepare to contract again. And then the cycle continues. P, QRS, T, P, QRS, T. So an EKG or ECG or electrocardiogram looks like this. This is how it occurs. They attach a bunch of leads on you, and if before you have surgery or something like that, they will do an EKG. So why do we use it? It provides information about our heart rate and our rhythm. In a stress test, they're going to do an EKG while you're exercising, and this helps doctors determine how your heart handles that increased workload during exercise. So let's look at some EKGs. Okay, here is a normal EKG where the heart rate is 60 to 100 beats per minute. We can see clearly the P, the QRS, and the T waves. Okay, small EKG where we see P, QRS, and T waves. Now, there are a lot of abnormal EKGs and ECGs, and if this is a field you want to continue in, you'll see a lot more. But we're going to focus on just a few. So what is an arrhythmia? An arrhythmia means an irregular heart rate. So you can see here that this spacing is not the same as this spacing. So when we have a lot of irregular spacing, that's an arrhythmia. So that means that the heart is not contracting in an organized way. And then we have tachycardia. Tachycardia, remember, is a fast heart rate. So you can see the space between each of these contractions is pretty small. Then we have bradycardia. And in bradycardia, the heart rate is slow. So you could see the space between the waves is much greater. Now, atrial fibrillation, or Afib, means we have irregular contraction of the atria. So remember the P wave was the atria contracting? We can see, look at all this irregularity. So the QRS wave looks okay, but it's even hard to tell where the T wave is because I've got all these P waves kind of all over the place. So Afib. Now for ventricular fibrillation, like you will die if they don't fix this, paddles, okay? You can see we don't even see evidence of the atria contracting. There's no clear QRS pattern. The ventricles are just out of control contracting. And if this is not resolved, the heart is not pumping effectively, blood is not going anywhere with any kind of consistency, and so this could result in death. Now with a myocardial infarction, you can see, look at this T, way too big, right? That means the ventricles are staying relaxed. Okay, something is up with the ventricular contractions. And then asystole is a flat line. There's no electrical activity in the heart. Okay. So what term means slow heart rate? Bradycardia. What term means fast heart rate? Tachycardia. What term means no heart activity? Asystole. What term means heart attack? Myocardial infarction. Which one of these ECGs shows bradycardia? Number 3, slow heart rate. Which ECG shows an arrhythmia? Number 4, irregular spacing. Some are close together, then far apart. Which ECG shows tachycardia? Number 1, fast heart rate. Which one of these ECGs shows atrial fibrillation? Number 5, that little P wave, I can't even tell. Like, is there a T wave? I'm not sure. There's the P waves are all out of control. What does this EKG show? Asystole. All right, so what did you learn today? And that's it. That's a whole lot, though. But the cardiac cycle, blood pressure, pulse, EKGs, plus some review thrown in. I definitely hope you did learn something.